was a physical therapist at first, and was interested in orthopedics and not so much neurological side of physical therapy. Did that for a couple years. My father's a physical therapist, as is my older brother, so it's kind of the family business. And then I found myself getting a little, I wouldn't say bored, but a little complacent with it. So I decided to continue my studies. I went back to school, to medical school, and decided to specialize in orthopedics. But once you get into orthopedics, then you find out there's a whole nother world of subspecialties. And I found that deformity correction and knee and hip arthritis were what I found my passions to be. So I continued doing my practice now is specialized pretty much for knee and hip arthritis, and I continued doing that. Once the Mako came along, for the partial knee replacements, I used that for about the past 3 years, and have had excellent results with it. And now they've launched their total knee application, and that's where it's really impressive because it allows for optimal alignment of the implant. Over the past 15 and 20 years, we've gotten very good at the components of the knee. So the total knee replacement has the metal, this piece of plastic, and then the metal on the bottom. And the metal that they've come to offer to us is very good in terms of longevity, as is the plastic in between. And there's not much more that we can do on that side. But research has found now the most optimal, or the biggest factor in longevity is the alignment of the implant. So for alignments, the traditional way, which we've done since the 1960s, is using jigs that snap onto the bottom of the leg, and we use this to eyeball. So if I'm looking at the leg here, I use this jig to set where I make the cuts to put the implants in, and you do it by eyeball. It's tried and true. It's been very reliable. However, there's always a little fiddle factor involved. With the Mako robot, we now can eliminate that last step. And research has shown that that is the most important determination of longevity of the implant. So now we can do that within fractions of a millimeter, and it's really exciting for reproducibility and getting the exact alignment that the patient will need. Very proud and excited to be the second person in the entire Houston area to be able to do this. As of April 2017, I received my certification, making me the second one in the area. I think the fourth in the state. So it's good to be able to offer this new technological advance. And based off of implants that I have great trust in, that I've used for years and years, done excellent by my patients, it's great to be able to put those in a little bit more precisely. It's the patients, honestly. It's the, people who have arthritis tend to be older, but they come along with great stories, and they're truly happy once they have the procedure. And they feel like you can see that you've made a lifestyle difference. So it's really, really rewarding.